She specializes in detoxification, nutrition, herbal wellness. You mentioned them. Healing people up and down here and there. I think when she came out with the detox medicine, I was part of the first batch of people that experienced, the detox, capsules. She gave me one. She said, Lagazee, no, I want you to try it. You understand me? I tried it. Now, listen, anytime I take that detox and I wake up in the morning, I frequent the loo. It clears my system. I feel so light and all that. You understand me? Ladies and gentlemen, Dr. Sharita Yazid, she's also the founder of Africa Culture and Wellness Festival. I don't know why Doc is no more, pushing this festival vibes again. I think there was one time Doc invited me to MC the festival. You understand me? And then boom, I went, I did, everything was everything. It was a colorful one. You understand me? At the Bree Gardens. You understand me? It was one of the sweetest, festivals, I ever witnessed in Ghana, in terms of, holistic vibes and all that kind of thing. Inviting Muta Baroka all the way from Jamaica and all that. It was a colorful one. Ladies and gentlemen, let's go online and talk to Dr. Sharita Yazid. Doc.
Greetings. I'm so sorry with this Zoom. I don't know. I'm not. I call myself to be tech savvy, but
okay.
Like I told you, I didn't even know TikTok was X.
No.
I have 6 children. They're supposed to keep me up to date, but
Oh God. Doc, the system is changing. You understand me?
Oh my goodness.
Things are moving so fast. You understand me? Mm-hmm. Yeah, but we give thanks. But we give thanks for you, joining us. You understand me? Over here, you understand, because we realized that the Zoom wasn't working, so we have to use other alternative to make sure that we are able to reason with Dr. Sharita Yazid. Now, Doc,
any means necessary.
We are pressed with time, but I want you to talk to us about yourself. If we talk about Dr. Sharita Yazid, who exactly are you?
Oh, I'm just a crazy wild woman from Compton, straight out of Compton. That just knows a little bit of something about wellness.
Mm-hmm.
Yeah, but I'm a naturopath.
Mm-hmm.
I'm getting an echo. Are you getting an echo?
No.
Okay, good. Yes, I'm a naturopath, which is a doctor who deals with healing naturally, the mind, body, and spirit. Mm-hmm. Having a holistic experience to heal the body from head to toe, inside out, all around.
Mm-hmm. Mm-hmm. All right. So and
ways by using different foods for healing, herbs for healing, meditation, exercises, just overall well-being for healing, without any invasive medicines, without using any type of orthodox poisons and things like that. Okay.
Summary. I was telling people that you've been doing this for 35 years now, and people, think I'm lying. I don't know if you can confirm that for us. For how long have you been doing this?
Oh, even longer. I would say 40 years now. I was kind of born into it. My father is a master healer. His name is the late great Dr. Paul Goss, who was my first teacher among many. And he's a master herbalist, iridologist. Iridology is reading the iris of the eyes to be able to determine the different ailments in the body. So it's kind of a way of that we use to diagnose. We can see things in the eyes before it even becomes symptomatic. So we believe very much into preventive medicine In other words, just don't have a reason to go into the hospital. Just try to prevent all of that. Unless it's some kind of accident, stay out the hospital. So we believe in doing more prevention medicine. And so I was, like I said, I was born into it. Me personally, around 2, they diagnosed me with chronic bronchitis, and I have to stay on a certain diet and regimen in order for me not to be symptomatic. As soon as I do stuff I'm not supposed to do, then I go into having like respiratory issues and things like that. So I've always used natural ways of taking care of it. And I'm here today, because of the herbs and foods and lifestyle. I've been able to do it. I was able to play sports, I dance, and all those different things. So I'm my own testimony as well.
Okay. All right. We give thanks every time. Before we step into the main reason why we invited you today on the show, why is it that the African Culture and Wellness Festival, why is it on hold?
Sika, moolah, money.
Easy.
Wow. Doesn't mean that
it's a lot to put those things together, Lagazee. And I was able to get a lot of support through people like you with the media and endorsements from the Ministry of Health and from the Ministry of Tourism. But it doesn't always add up to money. When it comes down to sponsorship from like some of these big companies, if you're not selling alcohol or you got big booty girls on the stage with a smile, you just don't get the sponsorship. They only sponsor things that really doesn't help us progress as a people. So all that time I was doing all this by myself. So between vendors and people maybe giving product, and I think the Ministry of Tourism gave me a couple of buses and bought all my tickets, the VIP tickets to the concert. That was the most I've ever gotten. So yeah, it takes a lot. And then not only that, it takes a lot of energy. It takes a lot of energy. And I just told myself, until I get the sponsorship and get a good group of people to come help me do it, I can't kill myself trying to do a wellness festival.
Wow.
Yeah.
Wow.
So,
that is why
videos from the past, it's all on YouTube.
so we understand now the main reason why it's on hold, for some time now, because I've been looking forward for this. The last one we had at the Bree Mountains, and then we had the likes of Muta Baroka coming in and all that. I'm like, wow.
Yeah, you were the MC.
Yeah. I wish it will continue. You understand me? But hey,
yeah, one day.
It's all,
we're putting it out there.
It boils down to Sika, so I understand you perfectly. Now let's move forward. Checking on the website of the World Health Organization, every October is Breast Cancer Awareness Month, and then this year the theme is every story is unique and every journey matters. Now, looking into our society, a lot of women, do suffer from this breast cancer, illness and all that. You understand me? Due to this, a lot of marriages, has gone sour now and all that. You understand me? Some women are even, some even feel shy to even come up because of this breast cancer and all that kind of thing. As a doc and as a person that deals with natural herbs and all that, first and foremost, let's talk about how to even take care of the breast in terms of maybe keeping it well to avoid this breast cancer. You understand me? Let's talk about that first. I want you to advise us on that first, Doc.
Yeah, so There's a lot of things that you can do to deal with early detection, and the breast cancer research has been out there for a long time, and I also believe in studies, which is my own studies, right? And my studies along my colleagues who deal with things naturally, and my master teachers who deal with things naturally, meaning that we're not researching somebody else's information. We're looking at our own studies and seeing what works and what doesn't work, right? But some of the things that they have put out there is really good information in reference to early detection. So let me give you about 7 different things you can do.
Okay.
So to look for 7 different things you can look for. So redness or flaky skin around the nipple area of the breast, irritation, dimpling, or other skin changes on the breast, breast pain, swelling of all parts of the breast, even if you don't see any lumps. Like things sometimes you just all of a sudden your breast just starts swelling. You're not necessarily gaining weight. You're just you want to pay attention to that. Sometimes one will be bigger than the other, but just look for changes in the appearance of your breast. Change in the size. I just said that. Nipple pain or nipple turning inward, like your nipples are turning inwards. If you have a nipple discharge other than breast milk, so if you're not breastfeeding, you got some discharge that's coming from your breast. Even if you are breastfeeding, you can tell the difference between milk and then some sort of sticky discharge. And then swollen lymph nodes under the arm or near the neck bone. So your lymph nodes are all throughout your whole body, but when it comes down to breast cancer, a lot of times you'll feel like some lumps under your armpit. A lot of times it might be painful or a little discomfort. But any little small change that you see that's not good, then try to do something to get it diagnosed. Now, I always like to tell my clients that if you're married, have your husband do something maybe once a week, once every 2 weeks, where he's massaging your breast, trying to look and feel for different lumps. I mean, or when you guys are making love, the breast is always involved. If he notices something different, tell him to speak up on it. If you don't have a husband, maybe you have daughters. And this is a really good one to do amongst your daughters, or if you have female friends, that you guys come together maybe once or twice a month and then just check on each other, just to make sure, because this thing is becoming almost like an epidemic. It's the biggest cancer in Ghana in general, and then definitely amongst women. Men get breast cancer too. I just want to say that. Men get breast cancer too, but it's the number one cancer that's in Ghana. And what I find in Ghana is that people wait till too late. They always talk about how strong the Black woman is and things like that. We've been made to be strong. We've been made to not, speak up on certain things and just go ahead and endure a lot of stress, pain, discomfort, and we keep going. Especially, I'm a mother of 6, so I know how it is to just ignore a lot of things and then keep going. But one thing about my body, it'll slam me down on my back and say that, oh, you don't want to listen? Sit down. So it's really good to have, other people involved in your health, and you're just checking on you. Are you okay? Have you checked your breaths over the last, couple of weeks, over the last month? Just checking on each other. And so when you're able to detect these things early, then you have a better chance of surviving it. Most of the time when people come to me, they're already in the 4th stage. The breast is already discharging. Even the skin is already broken through, and there's a lot of white pus that's oozing out. Or the breast is like started getting so big, and then they're coming to me where I feel like it's kind of too late, because you have to do so many drastic things to reverse it.
Okay.
Okay. Yeah. Go ahead. I'm sorry.
All right. So, Doc, you did you did mention that those with husbands, you understand me? And I'm a bit interested in that, you understand me? Let your let your husband feed on it and all that kind of thing. The only thing that the Bible says should satisfy a man is the breast. You understand me? And I thank you so much for you stressing on this, that husbands should do the needful. You understand me? What is the importance of husbands, feeding on it? I want you to tell us.
Well, feeling, the touching on the breast, because a lot of times when you're making love,
squeezing
we're all grown folks here, right?
Squeezing it.
A lot.
If you say touching, like touching it was like squeezing it, I don't know. That's the main reason why we put you on video, because I want you to demonstrate it for us. If you say like,
yeah, right. One thing about you are full of laughs.
Crazy.
If you said
I wish,
touching it,
if I was able to get to Zoom, I would have been able to pull up a diagram. But we're all grown folks. We all know what it means.
Okay, all right,
and,
all right.
When the men are grabbing the breast and suckling on the breast, you should be able to notice the difference between, especially been with your wife for years.
Yeah.
Had children with her. You know the difference between when her breast is when she's breastfeeding and it's filled with milk, and then when it's not. You get to learn your woman's body, but a lot of times we just ignore. And then also with that, we have to also look at, you said something earlier about our relationships.
Mm-hmm.
When it comes down to cancer in general, it does start emotionally, trauma, and it manifests itself into the body and to become a physical thing.
Mm-hmm.
It's also a mental thing too. Sometimes we feel like, oh, my mother had breast cancer, my grandmother had breast cancer, so they're saying that I'm going to get it.
Mm-hmm.
And this whole idea of hereditary diseases is not something that we believe in the holistic wellness community.
Mm-hmm.
Because why should you suffer from your grandmother's headache?
Yeah.
That's her headache, not yours.
Mm-hmm.
You see?
Mm-hmm.
So it's good to understand that you are an individual and you do not have to suffer because somebody else suffered. So get the mental part out of your head. I have so many people say, oh, I'm going to get cancer because my mother and father or grandparents had it. It doesn't have to be your disease, any disease. And then the main problem that we have, especially today, and I would definitely say in Ghana, this is worldwide, but what we're talking to Ghana,
mm-hmm.
we eat a lot of processed food. We eat a lot of processed foods.
Mm-hmm.
A lot of milks that are powdered. These chocolate powdered drinks. We do a lot of stuff that's a lot of biscuits, fan yogurt. All these different ice creams and dairy products. We're doing a lot more sugar than we usually do. And then we're not getting the fresh food, like the fresh fruits and vegetables. Even the fruit sellers, they don't even eat the fruit. Is there so they can make money to go buy, white rice and,
mm-hmm.
Yam and all these different things. And all those starchy things and processed foods cause a lot of the problem in reference to the diet side of it. Mm-hmm. Okay, so like you said, you have the emotional side, mental side, and then you also have the diet. Mm-hmm. Then you also have the environment. Now, when it comes down to environment, your home, your family, your workplace, you try to keep that stress level down as much as possible. If you're in a high stress in situation, learn meditation. Learn to be able to go somewhere, sit down, be still for 10 minutes to an hour at a time every day, and find that time just to be present, just to be by yourself. You see better with your eyes closed. You see what I'm saying? I can deal with a situation with my eyes open and I can just see what's right in front of me. But if I close my eyes, I can find 444 ways to deal with an issue.
Wow.
You understand?
Mm-hmm.
Yeah, so those type of things, lowering the stress level is very, very important. Stress does kill. It causes a lot of issues in the system, in the body. So that's that. That's that. Now, one thing I'm gonna kind of start with the end, because I'm gonna go back and go to the end, because this is something I want to make sure that people get, just in case they're not able to listen all the way through.
Mm-hmm.
Soursop. We have so much medicine in Africa in general, but
Mm-hmm.
soursop has had many studies in
Mm-hmm.
reference to being like chemotherapy like,
Mm-hmm.
but without having all the side effects, without your hair falling out, without you losing lots of weight, without your skin turning, a dark, ashy color or dry color. So what you would do, you're going to take 6 soursop leaves, right? And you're going to take a liter of coconut water.
Mm-hmm.
You're going to blend it.
Mm-hmm.
And then after you blend it, you're going to sift it. You're going to strain it.
Mm-hmm.
And then you're going to drink at least one of those every day. If you're in prevention stage, it's something to do like every other day, once a week, twice a week. If you're in the beginning stage, you're going to do that every day. If you're like second stage, third stage, you're going to do it every day,
Mm-hmm.
twice a day.
Mm-hmm.
Okay, so that's a medicine that you're going to be taking on a regular basis. Other things that you can do is things like moringa. Moringa is very high in a lot of different nutrients. It's very high in vitamin C. Vitamin C and zinc is going to be very important with building up the immune system and fighting off diseases. It's also good for fighting off bacteria. You want to do things like lemon water on a regular basis. Lemon water is really good for pulling out a lot of waste and toxins out of the blood, which in turn will help to cleanse the lymphatic system. And once the lymphatic system is clean, it's like the sewage system of your body, the lymphatic system. So when you don't cleanse your lymphatic system, one of the results is breast cancer, or it might be lymphoma. It could even be prostate. Uterine cancer, things like that. We have lymphatic systems throughout our whole body. So you have to look at foods that are really good for the lymphatic system, foods that are good for the breast. Things like I said, moringa. You can do cauliflower. Beetroot is really good. Any of the greens that we have there in Ghana, the yoy, the boma, the alefu, which is kalaloo with the Caribbean, they call it kalaloo. And all these different things are best taken raw.
Mm-hmm.
Not contumere. Of course, not contumere, but all these different greens are best taken raw. The fresher it is, the better off you are, the better results that you'll have. I want to give you time to give a question because I'm just talking.
No, we are all listening to the advice you're giving in terms of what you do in terms of prevention and all that, and I think it's good. You understand me? Where I need you to repeat it again for me is the soursop leaf and then the coconut water. You blend together, right?
Yeah. So take 6 soursop leaves, fresh leaves.
Okay.
But we can find it almost everywhere in Ghana, right?
Yeah.
And then you're gonna blend it with 1 liter of coconut water.
Yeah. Mm-hmm.
After you blend it, you're gonna sift it or strain it,
mm-hmm.
and then you're gonna drink that at least once a day. Mm-hmm. Let's just say that you've already been diagnosed with the breast cancer. You're in the first stage, second stage. You're gonna take that twice a day. You're gonna do so, meaning that you're gonna take 2 liters of this drink a day, mm-hmm. right? Mm-hmm. If you want to deal with prevention, do it at least once or twice a week. Okay. If you just feel like, okay, I've had this in my family, several generations, it's just in your mind that you might get it. Prevention is always the best medicine. Mm-hmm. Mm-hmm. So, but if you're in the 3rd and 4th stage, that's when it gets really, really difficult. That's why we try to get people to do more examination and get early detection. Yeah. Before, because it's really a difficult one. And let me tell you, I've had a couple of clients that came to me in the last stages, still walking, still on their feet, still doing everyday things, but they will go through these episodes where they have a lot of pain. breast size really increased. But one thing that I thought that they were going through, they had a lot of stress. They had a lot of marital stress.
Mm-hmm.
They had the children, they had, bills and all these, school fees and all these different typical worries that we all have. But they were really going through a lot of stress, disrespectful, traumatic stress, you know what I'm saying, with their husband. And sometimes it's hard to just walk away from that. Because me, myself, I believe in leaving a situation that is not healthy. Even if you, just to get yourself together, even if you come back later, but just to get yourself together, you know what I'm saying? Leave that situation and go and take care of number one, which is you. Because if you're not around, you're no good to anybody. You're no good to your husband. You're no good to your children, your family. So that was one of the things. The other thing is they had a very hard time changing their diet. Now I'm going to tell you to go vegan, raw food, doing lots of juicing. At least 70% of your food intake should be live juices, juices that are freshly made.
Mm-hmm.
And then their other food would be like salads, maybe fruit salad, different nuts, like pumpkin seeds are really, really good. Tiger nuts is really good. I don't think I'll say it right. Yogi, it's like a little berry that has this like black on the outside,
Mm-hmm.
and it has it's
Yeah.
orange on the inside. It's very high in vitamin C.
Yoyi.
Yogi.
Yeah.
And then we have Alasa.
Alasa. Yeah.
Alasa is really, really good and high in vitamin C. Like I said, I mentioned moringa before. And then all your citrus fruits, your limes, your lemons, your oranges, tangerine, all those things are really, really good. You want things that are very high in vitamin C.
Okay.
So when it comes down to people not eating jollof rice, not eating their fufu and their banku and all these, different foods, it becomes difficult because this is what you've been eating, the whole time. And I was saying the last two generations. Now, when we look at people who are 70 plus, maybe 60 plus in Ghana, they had a better diet.
Yeah.
Even if they ate white rice and things like that, they always ate green.
Yeah.
And so you might have things like abon, and they'll say, "Oh, that's the old lady's food." That's the old lady's food. And I'm thinking, it's primitive. It's primitive.
Yeah.
And I asked them, well, did you ever ask the old lady, how did she become an old lady?
Yeah.
If you want to become an old lady, go ask the old lady how she became an old lady.
Yeah. Yeah. You're right.
So we have to get past this. And to me, that's more of a European way of thinking. It's not African at all. You know what I'm saying? We feel like they set the standard. I'm sorry to get so political, but they set the standard. And we feel like that's the way we should go. So which is the reason why we have things like Kentucky Fried Chicken, Pizza Hut, Burger King in Ghana, when they're over here killing people here in America.
Oh God.
And we think that we're doing something when we take our girlfriend over to the Burger King, because you can afford to go to Burger King, and it's 3 times the cost that it is here in America, which is funny to me.
Wow.
You know what I'm saying? So we feel like the West is best, and I'm telling you, it is never, ever true. The African way is the original way. We need to learn our traditional ways of how we dealt with every aspect of our life, especially when it comes down to health. We went to the bush first. We didn't go to the doctor and take all these pills. We had our own inoculations and vaccinations. We didn't go and get some white man's medicine and put it in our blood and then have all these side effects and these things for autism, all these different things, problems that these children have, learning problems. We didn't have those issues. So we had to first remember that our way is the best way, is the original way. We're the original people. So of course we know. But we've been miseducated for generations now. and it's causing us to have these things like breast cancer as the number one cancer in Ghana. And it's also the number one cancer amongst Black women in America as well.
Wow.
There's a common thread.
All right. So at 55 going into the R2 here on Asaase Radio, the voice of our land. In the studio, I have Narubawa, I have Empress Debbie, and online I have Dr. Sharita Yazid reasoning to us about the knowledge, awareness, and then the natural solutions for breast cancer prevention. She's going into it and telling us, showing us all the natural ways we can use, to solve this particular problem. You understand me? I quite remember from the early 90s coming up, you understand me? I can say the late 80s, you understand me? I was a young boy though, but I really understand the rudiment and what was going on. I quite remember the only time we ate rice was Christmas time. You understand me?
Yes.
Christmas time was the only time you will see my family cooking rice. You understand me? And or when we have a visitor, from maybe somewhere, and then we decide to cook some small rice. But we eat a lot of plantain, a lot of yam, a lot of cocoyam. You understand me? We hardly even eat banku. You understand me? We eat kokonte a lot. You understand me? And all that. And all these things are high in fiber. You understand me? But nowadays, it has become like the order of the day that you have to eat rice. When you wake up in the morning, sometimes rice in the morning, rice afternoon, and rice in the evening. And these things are killing us. Doctor is advising us about that. I have Naro Bauer in the studio. Naro, Dog is listening.
Yeah, greetings, Dog.
Greetings.
Yes, I just wanted to chip in. The first thing is about the soursop, which we call alubuntu here, in case our listeners don't really know what he's talking about here. Yes. Actually, it's one of my favorite food, even though it's expensive here. But I mean, yeah, they say good things are not cheap anyway. So
yeah.
But you know what? Do this though. This happened to me by accident.
Yeah.
When you buy the alaguntingui, I just threw the seeds in the yard. All of a sudden, I have about 6 trees that are growing.
Oh, wow.
I just pull the leaves.
Yeah.
I just pull leaves and take it. And their trees are all over the place. You know what I'm saying? You don't have to necessarily go to the market to buy it. Find somewhere in your neighborhood.
I mean, those who don't have a place of their own.
But
anyway,
when you do get it, just grow it yourself, because the main thing you need is the leaf.
Yeah. All right, my question to you is, why do you think awareness about a natural prevention method is very low in many communities in Ghana?
I think it's awareness, education. It's education. A lot of these things we need to start talking to our students about in at least high school. The first year of high school is when you really need to start talking to our children about their health in general. And really, and understanding that the habit that we have picked up it's not ours. It doesn't belong to us. So education is the main thing. Another thing is, I found that my clients were shameful too. They had this shame, and I really don't understand why. I tried to, but they had this thing that they didn't want to tell anybody that they were sick or that they had problems with their breasts. Yeah. Women. Our breasts, this is what identifies us as a woman. You know what I'm saying? And here it is now, you have all these issues with it. And a lot of times, like when we're talking or we're having like frustration, we do a lot where we grab our breasts. We speak in negativity and we're grabbing our breasts. You see what I'm saying? So there's a lot of times a lot of things that go into how we end up getting this cancer. But like I said, education and then shame. I think as far as Ghana, I see that's part of one of the biggest problems.
I mean, talking about women back in the day, being shy about their breasts. I think today our sisters of today is different. I see so many breasts.
Well, they're not shy about showing them off.
Yeah. That's true. Because I see so many breasts on social media now.
But when there's a problem, even more so. Now you're used to showing your cleavage, or you used to wearing these tight shirts.
Yeah.
And then now you got this lump.
What about the age range? But in what age do you think most women actually get?
Well, I think the earliest that I found was, how old was it in Ghana? This woman was 30. She was 30. I just had one of my children's for my program. One of their mothers passed away. She was 37.
Wow.
So it's coming early. It's not something that it's an older person's issue. It comes early. So I would say between as early as 25 statistically to age maybe 55, 60, you're starting to see a high range of women with breast cancer or uterine cancer.
Anyway, my last question though, I just want a lighter note. Looking at especially what role should men play, especially married men, or if you have a girlfriend, especially Lagazee is a breast man, so someone like Lagazee, what role do you think Lagazee should play in terms of helping his wife?
My brother, talk for yourself. Talk for yourself.
What role do you think someone like Lagazee should play in terms of helping his woman to actually identify or, to prevent breast cancer, in terms of men helping their loved ones to also take care of their breasts and all of that?
Yeah, well, it's just like I said, it's if you really, really care about your wife and you want her to be here a long time with you, then you'll take out these things to do it, because it is becoming epidemic. No woman in Ghana should think that, it's not going to happen to me. You just do what you need to do to prevent yourself from getting that disease or any disease. And the men, like I said, they can massage the breast. Just like a woman when she's in the shower, that's another time to do it too. When you're in the shower and you're washing, fill your breast, and it's easier to feel it that way because you have the soap.
Yeah.
And it's easier for you to be able to go around the breast and feel if there's any hardness or lumps or soreness and things like that. But the same thing with the man, they should know their woman's body. And when they see that something is different, they should say something.
So does it affect women with big breasts, or just it's all around, or just tiny breast? I'm just being specific because of my brother here.
Any size breast, big, small, because it's not necessarily a breast problem. It's the lymphatic system.
Okay.
We also doing things where we're taking in different deodorants.
Oh, wow.
I use lemon for a deodorant.
Yeah.
After I shower, I take lemon juice. I put it under my arms. Not only does it keep the smell away, our body odor away, it also helps to go into the lymphatic system, and it helps with cleansing and getting rid of a lot of bacteria as well. But we're taking deodorant these days, and we're putting it under our arms with all these chemicals that don't come from anything that was made by us. It's poison. So it's lymphatic. It's the lymphatic system. It's not necessarily about the breast itself, the size and things like that. And again, men can get breast cancer as well.
Yeah.
Men can get breast cancer as well. You understand me?
Yeah.
So as a man, you should be squeezing your breast almost all the time. You understand me? Yeah, man. And
I don't know if you guys squeeze your breast all the time. Y'all squeeze other stuff all the time. Y'all always grab it.
All right, ladies and gentlemen, Empress Debbie is here in the studio. She's a woman, so I wanted to also speak on the behalf of the women, you understand me, so that she can ask the right questions, you understand me, in terms of how this breasting to do, so that at least if doc says we should feed on it, why not? We'll start it from here, and we'll begin to examine her, and then yeah, man,
Don't worry, sister, they won't touch you. All the way from over here, I will stop them.
The floor is
and for just so you know, Debbie has a big husband. Debbie's husband is very large and big. He will handle you.
What? Say that again. Okay, Doc. You mentioned using the use of deodorant. I wanted to find out if it can contribute to breast cancer. And question number two is can natural remedies alone cure breast cancer, or do they work alongside medical treatments or cancer treatments?
I think natural is the best way to go. When you get to the point where it's at a certain stage, people will go into chemotherapy, radiation, and at that time, natural ways of healing through foods is best to deal with it at that time. When you start mixing herbs and something happens, then you want to blame it on the herb. But when it comes down to food, we got to eat every day, right? So it's best to make sure that you're doing like a lot of juicing, eating lots of raw foods, eating nuts and seeds that are raw, nothing cooked during this time.
Okay.
But if you're in the first couple of stages or prevention, natural is the best way. There's different herbs that you can take. Detoxification, I'm sorry, I should have said this in the first place. Detoxification is the number one thing that you need to start off with, is cleansing your system. Taking colon cleansers, taking things that cleanse your colon, kidney, liver, and spleen, your bladder, your uterus, your lymphatic system. Go through a full detox. And this detox, I just started one last Sunday where I drank 16 ounces of olive oil. I took this herbal colon cleanse and I did it with lemon juice. And then for the first 24 hours, I was just going to the bathroom, releasing a lot of weight, lots of gallstones, lots of yeast, lots of bacteria, lots of toxins out of the system. That's the first line of defense, is to detox your body first.
Okay.
All right.
There's another one.
Okay.
Doc, can hormone imbalance also increase the risk of developing breast cancer?
Definitely.
Like irregular
your hormones being
periods.
off balance.
Okay.
And pretty much that is pretty much when it comes down to uterine and breast cancer, it is a hormonal imbalance. Thank you for asking that, because I had it in my notes to say it, but thank you for asking that.
Okay.
Hormones being off definitely makes a big difference. And the reason why our hormones are off, especially in a young age, is because of the foods that we're eating. They're putting hormones in the milk. They're feeding hormones to the cows, and we're drinking the milk. They're putting hormones in the chicken to make them grow faster.
Yeah.
And also you have a lot of foods that we are eating that are whole, like fruits and vegetables, but the way that they are grown, non-organic. So a lot of the pesticides that we're taking in, like that Roundup and things like that, it also alters the hormonal balances in the body.
Okay.
So organic is also, again, that's also the best way to go.
Okay.
And we have several organic co-ops that are out there that are working very hard to make sure that we get foods that don't have pesticides in it. So there's no excuse. We don't have any excuse in Ghana. We have everything that we need there.
Okay. And lastly, I think this is a question most women ask, which has to do with the morning after pill, whether that could also contribute.
Yeah, it could. It's usually that's not something that we take on a regular basis, because it's not like we're having sex all the time. But the birth control pill definitely contribute to it as well. It's better to go with something that's more of a natural birth control, or use a rhythm method. When it comes down to if you're not ready to be pregnant at the time.
Okay.
Can you please give explanation on that? The natural prevention, the rhythm method I just mentioned. I've never heard of it. I'm interested because I'm a man.
Well, you have to look at the time. Usually,
so
there's only a 1 week window of when a woman is able to get pregnant, which is a few days after her menstruation. I'm sorry. A week before her menstruation is that window when a woman can get pregnant. So if you look at the calendar and she's able to keep up when her menstruation is going to come, which I find a lot of people these days are not necessarily doing that. Even over here, like the young women, they're not necessarily keeping a calendar. But it's best to keep a calendar of your period, when it starts and when you expect it to come, which is every 28 days. And then if you see that it's abnormal, maybe it's starting to come every 2 weeks or every 3 weeks. Those type of things are letting you know that there's some kind of hormonal imbalance. So have your woman, or the woman should always keep a a note of their menstruation, and then that window where you can have children, where you can get pregnant, then don't have sex during that time.
Okay.
Wow. I'm not mentioning anything about condoms because condoms have lots of chemicals in it. And it doesn't necessarily stop disease like they think they do. Like it said, that it's stopping diseases because the condom is very porous.
Mm-hmm.
So things can still go through the condom and into the woman's body.
Mm.
So I'm not really a person that believes in using condoms, but after sex, it's really good to have a really good douching solution. Basically, like putting it inside of a water bag, and you have a tube where you're able to push water into the vagina that has maybe like some apple cider vinegar or some kind of herbal, like nunum or something like that, and put it into the water, and you cleanse yourself. Neem is also another good one as well. You can take neem oil after having sex, and then just take the oil and put it inside the vagina. Or before sex, you can also have put the neem oil on the man's penis before having intercourse. Wow. And those kind of things will help to deal with different sexually transmitted diseases that we might worry about. So like I said, I'm not really into condoms. And then a lot men don't like using them anyway. They want to feel they want to feel the real thing, so that's one of the
you're right.
Personally, I don't like the way the condom feels either. I think most women, if we can get away from all of that, we don't necessarily like the way the condom feels either. It's not natural. It's not natural.
Yeah.
So to get away from using condoms, you can do those things.
Okay.
Doc. There's a school of thought that speaks against douching. What is your take on that?
That's the European coming over there.
Mm-hmm.
And this is my thing. If it's been working for centuries, I've met some herbalists over there that's 10th generation herbalists. Mm-hmm. If it's been working for all this time, then why change it? Even when it comes down to enemas, they're telling people not to do it.
Mm-hmm.
And my thing is, if it's been working, why stop it? Because the reason why they want you to stop doing certain things is so that you can get some illness, some disease. They're going to tell you the bad food to eat. Yeah. And then they're going to tell you to wear stuff that's not natural, like you're supposed to wear underwear that's made from cotton.
Mm-hmm.
All these different things that they're going to tell you that you need to stop doing is because they're trying to make sure that they are able to get you to a pill or a knife.
Mm.
That's their only goal.
Okay.
So if you're looking at, and I saw that a lot, people going into the villages, people from Europe or from America, calling themselves going into from the medical field, going into the villages and telling them about their hygiene, about how they should eat, about the vaccinations they should get, all these different things. And then we start to see that now we're starting to have problems that we didn't have before.
Mm.
We got to start remembering who we are as a people and how we do things, and do not adopt a lifestyle that doesn't belong to you, and was never meant for you to excel in the first place.
Okay.
It's all to your demise, what these people are doing.
All right.
Okay.
Doc, I would like to find out, when exactly are you coming to Ghana so that we can have you live in the studio? Because they are saying things, you have to be here in person so that we can go deeper into them. When are you coming?
I should be there first part of December.
All right. So I think as soon as you step into Ghana, let us know so that at least we can invite you into the studio, because I think we need some of these holistic talks, you understand me, for people to know who exactly they are, you understand me. Mind you, our villages, that these people come all the way from, Europe
in the name of NGOs.
In the name of NGOs and all that, and they will come.
Oh my goodness.
Yeah.
That made me cry.
They will come advise you, do this, do that. After they advise you and they are gone, your situation worsen. You should know that you don't need to take their way.
No situation, just that. Look, let me tell you something. I was first here in America and I couldn't come back. And then when they opened up the borders, I was right there. When COVID hit Ghana, it didn't really hit us the way I'm in Los Angeles. Los Angeles alone had more deaths than all of Africa, the whole continent. One city.
Wow.
So I'm talking to an immigration officer. At one point in time, they were taking immigration officers also acting as military. They took military, they took social workers, and they took medical workers into this particular village. I was talking to him. I was coming to get something from him for a friend. And then he's telling me about that they had just came back from a village. We're talking about military. All these different people showed up. When they got to the village, they said, we have no COVID here, not one case, not one cough. Why are you bringing medicine here? Why are you bringing COVID vaccinations here? We have no problem here. You need to turn around and go back home. We will not take your medicine. And he said everybody turned around and they went back home because they knew the chiefs and the leaders of that place was very, very serious. I'm feeling like an African priest or priestess was standing on the side too. Like, don't you dare even pull out one needle.
Of course.
Because we have learned as Africans that when these people come from the World Health Organization or the Center for Disease Control, and they're coming with their NGOs, I think we're learning our lesson that when they leave, that we do end up in the worst condition. You see what I'm saying? So now they're not trusting because now we have a history. And I was so glad that he shared that story with me because it let me know that there's hope for us, that I don't have to worry about our youth, that we have people who are looking and saying, you know what, something is not right. I might not know what it is, but it's not right. So if you don't understand it, then just don't deal with it at all.
All right. Because of our time, we need to wrap it up over here. But before we leave you finally, I know you have a center over here around Ogbojo. That way, I would like you to, direct us to your center over there. And also, I'm
in Asaase, Aburi.
Oh, you are in Asaase?
I'm in Asaase. I'm in the mountains. I just moved there a couple of months ago. We're doing a wellness center. We still have our shop, but we're setting up a wellness center there in a 5-bedroom house in Asaase, Aburi, for people who might not know the small town.
Okay.
Aburi.
Okay. I think Doc, when you finally return into the country, you need to bring some of the product over here, on the show, so that at least we can go through them for people to know what exactly is on the ground. But before we leave you finally, Doc, I want you to advise, especially our ladies. You understand me? And also, if anybody want to contact you, you can also put your number out so that people can also contact you in case they need your help holistically.
Okay. All right. So our number to our wellness center, New Earth, New Body Wellness Center, it's 050-864-2828. That's 050-864-2828.
All right.
And we're open Monday to Saturday.
All right. So I want you to advise our women.
Oh, just okay. Just in general, in reference to the Well, okay. Let me just say this. As far as our women, we have to do more with self-care, taking out the time every single day. And this is my own lesson I had to learn when I was raising my children. That when you come inside, go into your room, put everything down, get yourself in a very comfortable space, and just sit and tell your children to wait, tell your husband to wait, tell everybody to wait. To give you 30 minutes just to be by yourself. Give praises to yourself. Look yourself in the mirror. Ask yourself, did I do well today? Or what is it that I need to work on today? You know what I'm saying? Do some self-assessment. Did I eat the right stuff, or I ate something that wasn't too good? What can I do to counteract it? Did I drink enough water today? You know, do some self-assessment, because we're always worried about everybody else, making sure that they get their food, making sure their homework done, making sure, you know, they're through their sports and all those different things. And then we're last. We put ourselves last. Start putting yourself first. I'm telling you, it will make a very big difference. When I started doing that, I went from walking into the door with my purse on my shoulder, and I go straight to the oven and start cooking. And then I realized, wait a minute, I still have my purse on my shoulder. This is ridiculous. So I started saying that, you know, I'm coming in, I'm going into my room. Children, don't knock on this door. Unless somebody is dying or bleeding, do not knock on this door. And then take out that time to go ahead and do that self-assessment, sit down, be still, relax yourself, and then go and take care of everybody else. Because if you take care of yourself first, you'll be in a better position to take care of everybody else.
Okay. Dr. Sharita Yazid, I would like to say thank you so much for your time and space, for talking to us on Yaad Settings on Asaase Radio, the voice of our land. 99.5 in Accra, 98.5 in Kumasi, 100.3 in Cape Coast, and 99.7 in Tamale. Thank you so much, Doc.
Yeah, thank you so much for having me. It's been an honor, as always.
All right. Blessings.